PROVIGIL. A brief overview. PROVIGIL, generically known as modafinil, is a prescription medicine used to improve wakefulness. If you are sensitive to modafinil, armodafinil, or any of its inactive ingredients, do not take this medication. PROVIGIL helps decrease daytime sleepiness. It was found effective in treating sleep disorders such as narcolepsy, obstructive sleep apnea, and shift work disorder. PROVIGIL will not cure any sleep disorders, and therefore it should not take place of getting enough sleep. Absorption of PROVIGIL tablets is usually very rapid, with a peak occurring at 2 to 4 hours. The exact mechanisms of how PROVIGIL promotes wakefulness is unknown. However, studies have shown that PROVIGIL has effects on the suprachiasmatic nucleus. The suprachiasmatic nucleus controls the body's circadian rhythms. The suprachiasmatic nucleus receives inputs such as light signals from the retina, which keeps the rhythm synchronized to day and night cycles. It is also suspected that PROVIGIL increases the amount of orexin neurons produced in the brain. Orexin neurons excite brain nuclei that excites dopamine, norepinephrine, histamine, and acetylcholine systems, which play important roles in wakefulness. Both orexin neurons and the suprachiasmatic nuclei are found in the hypothalamus of the brain. The hypothalamus is typically responsible for maintaining wakefulness. The suprachiasmatic nuclei and the orexin neurons send outputs to the hypothalamus, and these signals control the production of various hormones that regulate behaviors such as sleeping. Unlike PROVIGIL, stimulants such as amphetamines work primarily on increasing the amount of dopamine in the synaptic cleft. Since PROVIGIL works differently than amphetamines, PROVIGIL is often seen as a safer medication in promoting wakefulness. Since PROVIGIL does not work primarily on increasing the amount of dopamine in the synaptic cleft, there are typically less heart and cardiovascular issues with taking this medication. There is also a less potential of abuse while taking PROVIGIL, since PROVIGIL does not give the user as intense of a euphoric high as amphetamines typically do. PROVIGIL, much like any other medications, has potential hazards one should consider. PROVIGIL may alter feelings typical of other central nervous system stimulants. It can produce psychoactive and euphoric effects, alterations in mood, perception, and thinking. PROVIGIL is a federally controlled substance because of its reinforcing properties. Taking PROVIGIL can lead to abuse and dependence. The main route of elimination of PROVIGIL is by metabolism by the liver. If you are known to have liver issues, taking PROVIGIL may not be right for you. PROVIGIL should be taken during the daytime, since taking PROVIGIL close to bedtime may cause difficulty in falling asleep. PROVIGIL is also not recommended for women who are nursing or pregnant. PROVIGIL does not eliminate the abnormal tendency to fall asleep. Therefore, patients should avoid operating heavy machinery while taking this medication. PROVIGIL and many other medications can interact with each other, sometimes causing side effects. PROVIGIL may affect the way other medicines work, and other medicines may also affect how PROVIGIL works. Therefore, it is very important for you to tell your doctors about the medications you are taking, including prescription medications, non-prescription medications, vitamins, herbal supplements, and hormonal birth controls. PROVIGIL, much like any other medication, have potential side effects. Some serious side effects include Stevens-Johnson syndrome, a severe skin rash that causes the blistering and peeling of the skin, swelling of the face, eyes, lips, tongue, or throat, which can cause trouble in swallowing or breathing. Taking PROVIGIL may also lead to some mental symptoms such as depression, anxiety, hallucinations, mania, thoughts of suicide, and aggressive behavior. And since PROVIGIL is a stimulant, taking this medication may cause heart problems including chest pain, abnormal heartbeats, and trouble breathing. These serious side effects are often very rare. However, one should still take precautions while taking this medication and look out for the symptoms of these serious side effects. Some mild side effects may include headaches, nausea, and nervousness or anxiety. If symptoms of serious side effects begin to show, please notify your doctor right away. If mild side effects begin to worsen, you may also want to consult your doctor. Like any other medicine, if Provigil is not taken as directed, there may be a risk of overdose. Symptoms of overdose may include trouble sleeping or restlessness, confusion and feelings of disorientation, hallucinations, irregular heartbeat, and an increased blood pressure. When taken as directed, Provigil can be a safe and effective way to promote wakefulness.